Hey guys, welcome back. In this video we're going to look at some techniques for the rotator cuff and the glenohumeral joint in general. So I'm working here on getting the glenohumeral joint up into abduction, opening up, particularly we can get some tension in the posterior armpit here, the posterior axilla, where the teres minor and teres major are. So if that's the case there, bring the arm up as far as is comfortable, sink into the back of the axilla there, and then see if we can stretch the arm a little bit further. So that's a pin and stretch technique, using the base of my palm or perhaps making that fist there and coming in using the knuckles and stretching through. We can then lengthen that out a bit with a broader technique coming down over the lats, bringing the arm up into as much abduction as possible. So if you've got a very stiff arm with your client, you are going to be working down in this lower range and just doing the best you can to mobilize the soft tissue and see if you can get a bit more range of motion, elevation, abduction from the arm. With a more mobile client, their arm is probably going to be up here and you're going to be doing some broader techniques down over the back. Being careful not to overuse your thumbs, you can press the thumb into the back of the axilla there, pinning in over teres minor and then stretching the arm up or over towards you into that forward flexion and getting some extra range of motion achieved from that pin and stretch technique. Coming through onto the chest here, sinking into the pec major with the arm slightly elevated into forward flexion and then bringing the arm back into that horizontal abduction, essentially stretching the arm away from the soft tissue that we're mobilizing. So here, the chest is nice and soft, pec major is nice and soft. That allows me to sink into the muscle and then I can stretch the arm away. So it's that pin and stretch technique, except it's not a pure pin and stretch because we've got some glide through the soft tissue. Here's another simple pec technique that works well. Roll the arm towards you to shorten the pecs there. Sink into the soft tissue and then as you do that, release the arm and push the arm away into external rotation. So approximate, internally rotate, massage away and release and push the arm away so that there's some external rotation. So do that again. Internal rotation, release and external rotation. The next technique is one of my favorites for improving either external rotation or internal rotation, or both. Here's what you do. The arm out to the side, ideally at 90 degrees abduction. Hold the forearm, patient's arm is nice and relaxed. Then take one hand, come just off the pecs onto the upper arm, get as much contact as you can, and then scoop around medially through the upper arm at the same time as you externally rotate the arm by pulling the arm back into external rotation. I'll go through that again, starting in internal rotation, come off the pecs, scoop around the arm, move the arm into external rotation as you provide that counter pressure rotating into internal rotation. So you've got that shearing in the soft tissue as you're mobilizing one way and massaging the other. That's for external rotation. For internal rotation, if you haven't guessed, you start in external rotation. Grab a hold of the soft tissue around the back of the triceps and then mobilize the arm into internal rotation as you massage in the opposite direction. Okay, and repeat that the other way. Massage and rotate. You can make this a bit more of an active technique by using both hands to grab a hold around the soft tissue and then asking the patient to mobilize into external rotation. Good. And again, patient starts in internal, grab the soft tissue around the upper arm and move into external. This external rotation movement also stretches through the pectoralis major. So what you can do is come through, massage down inferiorly to pin the pectoralis major tissue as you externally rotate the arm to create some shearing Show you that again. Massage down into the pecs there as we externally rotate the arm. Here's a technique you can do for the pec minor. Have your fingers straight, come around the pec and drop in to the front of the armpit, the axilla. You're going over the ribs so that you're between the ribs and the pec major, pressing in as far as is comfortable, but also not too far, just so you can feel the ribs there. And then that is the pec minor release technique. It's then an option to add in some movement as well to see if that speeds up the feeling of reduced sensitivity and release. But when you do that, make sure you're not causing any extra unnecessary discomfort. Hold this technique for around about 10 to 20 seconds and then release. See if it's given the patient some extra movement or less pain and tension. If it has, then you could go in and try again for another 10 to 20 seconds before retesting them and then performing 2 to 3 sessions of that, or 2 to 3 repetitions. That's usually plenty. Not many patients like having this area poked and prodded. So in the first instance, make sure you consider whether you're going to do it in the first place. And if you are, then keep the intervention fairly brief, as usually that's all that's required. For the pec minor technique, it's an ideal place to use a massage tool. Here I'm using the Rock Blade Mohawk, which I've chosen because of its shape. It's got a smooth beveled edge, which allows me to glide in and press in over the pec minor. Typically, this is more comfortable for the client and it's much easier for you, much less stress on your fingers as well. So that's a recommendation when you're working with the pec minor. Consider using a massage tool. Here's a technique to target the subscapularis. Ask the patient to elevate their arms so you can get to the scapular border there. And then from here, we're going to apply some pressure down in towards the subscapularis as the client lifts their arm above their head. You could do a general technique where you use this base of your palm, that thenar eminence there. Place that over the front of the scapula. Hook your fingers behind and ask them to use their opposite arm to stretch this arm up into elevation. Okay, that's one technique. To get a bit more of a pin and a bit more precision, take your thumb and use that to locate over the front of the shoulder blade, getting the subscapularis tissue, or at least some part of it, and then again get them to elevate their arm up over their head. And that one is much more precise, and typically clients report that they can definitely feel that is targeting the right area and getting much more of a treatment response. But just be careful with that one because you are using your thumb. So don't overuse your thumbs and consider switching to just using the base of your palm as a general approach, or we were just using the massage tool. So once again, we could use that, okay, and lift. And that works well. If you don't mind using some massage tools, great way of saving your own thumbs and fingers. Here's another technique for targeting the subscapularis. Patient on their front, arm off the side, so they're at the edge of the couch or the side drop down here as we've got. Then find the border of the scapula, get underneath the scapula to get into that subscapularis tissue, and that's the way to apply the pressure. What I'm then going to do with my other arm is just to provide some support underneath the client's arm, like so, and then like so. And then I'm going to ask them to internally rotate their arm, which my client's familiar with that movement because we did some practice before we filmed. Otherwise, you'd want to take them through the movement so that they know what it is you're asking them to do before you start the procedure. Here's another way of getting into the subscapularis with a patient in a side-lying position. This, of course, is similar to the one for the serratus anterior. When we did the serratus anterior, we came up off the ribs towards the lower part of the scapula, and that's how we targeted the serratus anterior there. This is different because we're going to roll in over the top of the shoulder blade there, and then sink in front of the shoulder blade to get into the subscapularis tissue. And I'm going to aid that by pulling the scapula over the top of my thumb, so pulling the arm towards me, allowing my thumb to sink in a bit deeper into that subscapularis muscle tissue, like so. Keeping an eye on the patient's response, keeping an eye on my client's face to make sure there's not too much discomfort. And that's really all we need to do, holding that for a few seconds, perhaps up to 10 seconds, followed by some release, some soft tissue mobilization, and then coming in again, pressing and bringing the arm towards me. This is a technique for the supraspinatus rotator cuff muscle, where the muscle belly sits just above the spine of the scapula, in that indent, in that fossa just there. So there's three parts to this. Firstly, the setup. Place one hand in front of the shoulder so that you've got a hold of the shoulder like so. And then you're going to use your fingertips, put them in a hook position, and start up on the neck and track down to just above the spine of the scapula. That's the horizontal ridge on the back of the shoulder blade there. Okay, so holding the shoulder, tracking down to just above the spine of the scapula. When you get there, lock into position, hold the shoulder, and then part 3 is to pull the whole shoulder down away from the head, away from the ear. So a traction whilst you've hooked with your fingers and you're pulling with your hand. Okay, once again, tracking down, lock into position, and traction away. Okay, coming down, lock into position, and traction away. Okay, thank you. I hope you found that video interesting. Let's see what we've got coming up. See you in the next video.